Awesome. Hi, everybody. We are going to give everyone a couple of minutes to log on, and then we will get started. Thanks for joining us this evening. While we wait for everyone to get logged on, I'm going to go ahead and share my screen. Shannon, can you see this okay?
Yes.
Awesome. Okay, we will start right at 8:01 just to make sure everyone has time to log on. Okay, can you still see it?
Yes.
Awesome. Okay. All right, and as everyone's getting logged on, just a quick reminder that we are recording this session. So if you miss any information, you will be able to access this via the replay, which we will upload to our YouTube channel. And it should be up there probably by tomorrow or the following day. So we are just after 8 o'clock Eastern time. So we're going to go ahead and get started. Thank you all so much for joining us this evening for our September TIMS user group meeting. The title of this event is Building Better Tools, A History of Collaboration in Swallowing Diagnostics. In this presentation, Shannon and I will be diving into the rich history of collaboration between speech-language pathologists and TIMS Medical. We will be discussing different analytic tools, methods in the TIMS MVP software, features and benefits that are within the software, as well as research and continuing education initiatives that come from direct collaboration with speech-language pathologists like yourselves. With that, we're going to go ahead and get into our content for the evening. Our course objectives. By the end of this course, we hope that you will be able to summarize the benefits of standardizing swallowing diagnostic processes and analysis, describe software tools and features that can help improve patient outcomes, explain the benefits of industry and clinical partnerships, and identify action items to support research initiatives. Here is our course timeline, and as you will notice, we do have a block of time at the end for open discussion, but we really want these sessions to be open and collaborative. So if you have questions, comments, or feedback, please put them in the chat or the Q&A section. While I'm presenting, Shannon's going to be monitoring that and vice versa. And then, of course, like I mentioned, at the end, we will have an open forum discussion and a Slido for participation because we want to collaborate with you all. Some quick introductions. My name is Brooke McGivern. I'm a practicing speech-language pathologist here in Iowa and the Director of Marketing and Communication here at TIMS Medical. And I'll hand it over to my colleague Shannon to introduce herself.
Hi, everybody. My name is Shannon Marks. I'm also a speech pathologist, and I'm the inside sales manager for the West region of the US and Canada.
Here are our disclosures. As you may have guessed, Shannon and I both receive a salary from TIMS Medical. Additionally, I receive a salary from Maryville University and Mercy Medical Center, and neither of us have non-financial disclosures for this presentation. A couple of housekeeping items before we get started. This event is eligible for 0.1 ASHA CEUs or 1 PDH. In order to obtain the ASHA CEUs, as with all of our events, we will ask that you complete the survey. We will post the link in the chat prior to the conclusion of this event, and we will send it out again via email from Zoom. If you're not subscribed to the emails from Zoom, don't worry, you'll be able to access the survey from our website as well, and we'll keep it open for a week, so it'll be open until next Monday. So if you can't find it, just send me an email at tims-univ@tims.com and I can send you the link. Additionally, if you track your own CEUs or you prefer PDHs and you want a certificate of completion, or you just want a certificate of completion in general, please send us an email at tims-univ@tims.com and we can get you one sent over. And then, as I mentioned, if you have questions, feedback, or any collaborative comments, feel free to put those in the chat in the Q&A section, and then we will also have an open forum discussion at the end of this presentation. So a quick recap of what the TIMS user group is for those who are not familiar. Our TIMS user group has been around for a while now. However, our monthly meetings are new this year. And our goal with these meetings is really to create a community around the TIMS MVP software. Our goal is that anyone who is a student, clinician, or researcher utilizing this software will feel a sense of community with these meetings in which we will collaborate and learn new ideas from each other and really help elevate our field in terms of best practices. Our monthly meetings will include guest speakers to provide insight and expertise, open forum discussions as we had last month and this month, opportunities to provide our team with feedback and ideas. As you'll see in this presentation, a lot of the updates and innovations in the software have come from direct collaboration with SLPs, so we want to hear from you. And then, of course, complimentary ASHA CEUs. You can see some of our topics listed below. And as I mentioned, we really want to hear from you all. So if there are topics that you all would like to see presented at future sessions, please let us know. Additionally, if you are using TIMS for something really special in your clinical practice or research and you would like to be a guest presenter, please reach out to us. You can do so again at tims-univ@tims.com, because like I said, we really want to highlight people that are using TIMS and have best practices and ideas to share with the field, which is what these meetings are all about. So to kick things off, we wanted to give kind of a fun background story about how TIMS Medical began collaborating with speech-language pathologists. For those who don't know, TIMS Medical was actually created by our parent company, Foresight Imaging, which has been around since 1999. Foresight Imaging specializes in video capture boards, and back in 1999, they really specialized in defense imaging, so imaging for the military. In 2004, they created TIMS Medical, which really helped bring us into the healthcare sector. At that time, TIMS was primarily working with radiology teams across the United States. At a site visit in 2004, our vice president, Tony Molinari, who some of you have probably connected with in the past, was visiting one of the radiology teams that they had recently been collaborating with. And during that visit, an SLP walked into the room and was raving about the benefits of TIMS for her speech pathology team. At that time, she had just happenstance come across TIMS in the radiology suite and realized that she could utilize it to archive her MBS studies over to PACS. And this is really how TIMS began collaborating with speech-language pathologists. At that point, the trajectory of TIMS really changed because TIMS began to focus on specializing the software not only for radiology colleagues, but also for speech-language pathologists, which has helped create the product that you see today. Fun fact, TIMS has been involved with speech pathologists for so long that our very first ASHA was all the way back in 2008. So we've really developed a close relationship with speech language pathologists. And as you all saw this evening, Shannon and I are both SLPs who have joined the team in the past couple of years. So next, we wanted to talk a little bit about where we've been and where we're going as a company to kind of bring this full picture and really demonstrate the importance of partnership with clinicians, students, and researchers. So as I mentioned, clinical partnership is really important to us at TIMS Medical. The software that you see today, as I mentioned, really began in development with that initial collaboration with the speech pathologists. Today, we continue to collaborate with speech pathologists both here in the United States and abroad to create tools and resources to advance medical innovations and improve patient outcomes. So as I mentioned, much of what you see in the software today has come directly from customer feedback over the years. Our goal is to continue to enhance the software to meet the needs of the field and really help improve those patient outcomes. Additionally, we are passionate about providing resources backed by evidence, as well as supporting the implementation of standards. Although we know from current research that standardization is important, we also at TIMS appreciate that it can be challenging to implement new practices as well as standardization, which is why we really strive to make the tools and resources that you see in the software efficient and easy to implement. Additionally, of course, we want to provide resources backed by evidence through our continuing education offerings as well as our website. So if you haven't already, be sure and check out our website where we've got a resources tab full of information backed by evidence. Our goal is to make information accessible and easy to really implement in your clinical practice. As I mentioned, we are passionate about continuing education, which is why this year we have launched the TIMS University platform, as well as these online TIMS users group meeting. And our goal is to host some in-person meetings next year, so stay tuned. Additionally, as we will discuss later this evening, we have also launched partnership with graduate programs across the United States this year. Our ultimate goal as a company is to improve patient outcomes, and we know that that is your goal as well. So we really are thankful and grateful to partner with you all in this long-term goal. So diving into our content, as I mentioned, we all understand that standardization is important. Current research demonstrates that the lack of standardization can hinder the clear interpretation of functional results. Additionally, it may lead to unclear reporting of outcomes and has the potential to complicate the identification of surgical and rehabilitation targets. Oops. So, what are the benefits of standardization? We know that standards can improve reproducibility, transparency, consistent patient experiences, reliability, the adoption of best practices, clear expectations, and improve patient outcomes. Although we know all of these things at TIMS, and we know that you all know these things as clinicians and researchers and students, if you're a student, we also recognize that in the clinical world, in the hustle and bustle of the hospital setting or any medical setting, it can be difficult to implement standards right away. And there are several challenges and barriers that can occur in that process, which is why we've really, like I said, we're striving to make the adoption of standards easier, as we will discuss in this presentation. So next, we're going to talk about analysis methods that are within the software that if you're using the software, you've probably already seen and hopefully are utilizing. So first, we're going to discuss the Modified Barium Swallow Impairment Profile, or MBS-IMP. The MBS-IMP is a standardized method for teaching, assessing, and reporting physiologic swallowing impairments based on observations from the MBS study. The MBS-IMP provides a consistent framework for training, administering the protocol, assessing swallow function, and reporting results. It standardizes the language, analysis, and outcome reporting related to swallowing impairments. The MBS-IMP, which was created by Dr. Bonnie Martin-Harris, featured here, assesses the swallow function by examining 17 key physiologic components necessary for normal swallowing. Each component is scored using a defined metric, which allows for an accurate description and quantification of impairment levels. These scores combine to create a comprehensive assessment that helps us target evidence-based interventions. The MBS-IMP was validated in 2008 through a 5-year study which demonstrated inter and intra-rater reliability, which exceeded 80% among trained clinicians. This was published in the Dysphagia Journal. Further, Kane et al. In 2022 conducted additional research which showed that the MBS-IMP trained speech-language pathologists can demonstrate good inter-rater and intra-rater reliability. In conclusion, we know that the MBS-IMP assessment has excellent structural validity and internal consistency. In addition to the MBS-IMP itself, Dr. Bonnie Martin-Harris and her team at Northwestern have created another awesome tool, which is the MBS-IMP Global Swallow Data Registry. So if you're not familiar with this amazing tool, currently there are 120,000 MBS-IMP swallow studies that have been added to this registry from all over the globe. Dr. Martin-Harris and her team are utilizing this information for research purposes. For example, they're using some of the data to assess specific phenotypes for individuals with dysphagia. So if you are an MBS-IMP certified clinician or looking to become an MBS-IMP certified clinician, you can actually add to this Swallow Data Registry, which helps aid in science and further research. And you can easily add your scores through the TIMS MVP platform. So we've worked closely with the team at Northwestern and Northern Speech Services, to make our platforms compatible so that we can ease this process. So if you're not already uploading your MBS-IMP studies to the registry, but you are doing MBS-IMP, we highly encourage you to consider just taking the quick second to log in and do so, which we are going to demonstrate now. So in this demo video, you can see that Kayla Graham is scoring her MBS-IMP within the TIMS MVP software. As soon as she's done scoring, she's going to click that little MBS-IMP upload, and it's going to prompt her to log in. She was already logged in, so it just popped right over to this section where she's going to fill out patient information. And if you want to see this full video, it is available on our YouTube channel as well. When you click Send an Open Site, it's going to take you over to the MBS-IMP site. And here, the MBS-IMP site will actually provide you with an MBS-IMP specific report, which includes the anatomical graph at the top, as well as the MBS-IMP results, including a nice scorecard with the components and the score. So you can either download and edit the report, or you can also edit the study data, as Kayla is going to do next. So we just wanted to take a moment to highlight this, not only because of the wonderful report that you can access through the MBS IMP website, but also because it highlights our ability as clinicians to aid in research endeavors through the Northwestern team. So if you aren't already doing that, you might consider implementing this into your process. Next, we want to discuss the dynamic imaging grade of swallowing toxicity, or DIGEST and DIGEST fees. The National Cancer Institute's Common Terminology Criteria for Adverse Events, or CTCAE, serves as a standard for reporting toxicity in oncology trials. DIGEST was developed in 2016 by Dr. Kate Hutchinson to create a CTCAE-compatible modified barium swallow grading system to evaluate pharyngeal dysphagia as a toxicity endpoint in head and neck cancer. The proposed 5-point MBS grading system was designed to assess the interaction between pharyngeal residue and laryngeal penetration and aspiration. Intra-rater reliability for DIGEST was excellent, with substantial to near perfect inter-rater agreement. DIGEST effectively differentiated levels of pharyngeal dysfunction, swallow efficiency, perceived dysphagia, and oral intake. DIGEST adapts the MBS grading to the CTCAE framework used in oncology trials, which provides a reliable tool for head and neck clinical trials, toxicity profiling, dose response evaluation, and predictive modeling. Updates to DIGEST criteria, which incorporated 2 modifications in the decision tree, found maintain criterion validity. If you're using TIMS, you probably realize that DIGEST and DIGEST fees are both in the software. In 2021, Heather Starmer and colleagues completed research to validate the DIGEST for use with fees. This study found that DIGEST fees was a valid and reliable scale to describe pharyngeal dysphagia severity for individuals with head and neck cancer. So for those who haven't seen the DIGEST and the DIGEST fees in TIMS, we want to provide some screenshots just demonstrating how to access this analysis method within the software. So just the same as you would access it, or access the MBS IMP, excuse me, you're going to click your scorecards, and you can see that we've got our DIGEST open, and we've scored our DIGEST. And then when you click the results tab here, if you look on the right-hand side, we've got our overall results, so our safety grade and efficiency grade. Additionally, if you are using MBS IMP and DIGEST in your clinical practice, these scores for both scorecards auto-populate over into your customized report. So if you're using our reporting, those can automatically be pulled over into your report, so you don't have to rewrite any of the results, which helps improve from an efficiency standpoint. Next, we're going to discuss the robust esophageal screen, or the REST. Developed in 2019 by Dr. Stephanie Watts, the REST is a standardized and validated protocol designed for use during modified barium swallow studies. The REST enhances the identification of potential esophageal pathology. In 2021, Dr. Watts found that a systematic multi-texture esophageal screening protocol, when interpreted by speech-language pathologists, accurately identifies multi-phase dysphagia and should be incorporated alongside the standard MBS testing. Including a brief esophageal assessment provides a more complete evaluation of dysphagia symptoms and facilitates multidisciplinary care. In 2023, Dr. Watts and Jessica Greger conducted an internal quality improvement project, or QIP, at the Mayo Clinic in Phoenix, Arizona. This QIP aimed to educate and train SLPs in administering the REST and assess the feasibility of implementing the REST protocol within a multidisciplinary swallow clinic. The results of this QIP demonstrate that emphasizing the assessment of dysfunction and interaction across the swallowing continuum can significantly enhance patient care by streamlining and clarifying the next steps for the multidisciplinary dysphagia care team. We are really proud to announce that the REST is coming in our next TIMS MVP update. So if you were at our meeting last month, we mentioned that it was coming, and we have official timelines that it will be released with our next software update, which will be available prior to the end of the year. So we wanted to provide just a quick brief look at what the REST will look like within the TIMS software. So to summarize this section of the presentation, we covered the MBS IMP, DIGEST, and the REST. There are additional analysis methods for both the MBS and fees, but by using the 3 that we covered this evening, you can see how you can utilize the software to implement new analysis methods backed by evidence, as well as standards in clinical practice. So if you're interested in learning more, we did want to include a couple of resources for you, and these slides are available for download. If you'd like to access them, just send us an email at tims-univ@tims.com and I can send them to you. But we've got the resources hyperlinked in each of these slides. So MBS IMP, and their website does have a lot of great information about the MBS IMP. And then you can access digest training through MD Anderson, available here. And then if you're interested in learning more about esophageal dysphagia as a whole, or the research behind the rest, or if you're interested in becoming certified in the rest, you can do so via the Esophageal Collab website, which is available here. So with that, I'm going to pass it over to Shannon, and she's going to dive into various tools and features in the TIMS MVP software, as well as how those tools were created with speech-language pathologist collaboration. Shannon?
Thanks, Brooke. So next I'm going to be talking about an optional add-on feature called Patient View. Patient View is a tool where you can use a secondary camera that is positioned towards the patient, you and the patient, or perhaps the patient and a family member. The second external camera can be a USB webcam, for example. Patient View was in part initially developed by Dr. Susan Langmore's request to do simultaneous MBS and fees. So we are now able to complete this through picture-in-picture, which you'll see what this picture-in-picture looks like in some upcoming slides. Patient View can be used during a live MBS or fees study for biofeedback for training compensatory strategies. You could also use the recording later on for subsequent treatment sessions on your TIMS review workstation to be able to provide further patient education and training on how those compensatory strategies and positional changes make internal impacts on their swallow. And so the first video on the left-hand side, we are going to see Brooke scoping herself with the Atmos USB distal chip scope. So in a few moments here, Brooke is going to provide some external manipulation on herself, and then you're going to be able to then see the effects internally. So Patient View is a great way to be able to visualize the effects of manual therapy. And just a quick technical note about this feature, you can change the size of the picture-in-picture. So if you want to make that patient view on the right-hand side a little bit smaller, a little bit bigger, and you also have the flexibility to change the corner in which the box is in as well. And for our second video here, we have a great collaboration between industry partners at DRS. So here we have the PATCOM USB distal chip scope being used while the scopee is doing EMST and AmpCare, all while being recorded by the TIMS software. This joint collaboration was done to be able to see the impact of EMST and AmpCare through the fees and TIMS visualization. So the scopee here is able to see themselves in that patient view that you can see on the lower left-hand side of the TIMS software on the monitor. And the patient view was able to provide biofeedback throughout this pseudo treatment session at DRS.
And if you'd like to check out this full video, you can see it on our Instagram or on our YouTube page.
Another optional add-on feature for TIMS users is TIMS Connect. TIMS Connect allows for two-way video and audio between a TIMS unit and a TIMS review workstation that is on the same hospital network. So this can be utilized for real-time collaboration, perhaps with another SLP for a complex case, or for multidisciplinary collaboration for a patient who is undergoing a multimodal investigation in order to find the appropriate diagnosis. This could be used for training students, new staff, or perhaps current staff on a new competency. And depending upon your state guidelines and hospital policies, it could also be used for a remote radiologist. We do have a couple sites who are using TIMS Connect for a remote radiologist in Ohio and West Virginia. So there are a lot of different ways that you could utilize this for your practice. We want to specifically highlight a particular application of TIMS Connect at Northwestern. So Dr. Bonnie Martin-Harris uses TIMS Connect to help teach her SLP students to provide a more immersive experience for swallow studies, particularly when those students are not able to be physically in the fluoro suite. And with TIMS Connect, you do also have the option to allow the remote viewer to take over the MBS unit if there's something specific that they want to point out or control for educational purposes or collaborative purposes. And Northwestern was also previously using TIMS Connect for collaboration between the radiation oncology, head and neck cancer team, radiologist, and SLP team. So the teams would remote into the first MBS study post-cancer treatment for live results. The next feature is comparison, and this is personally one of my favorite features in the TIMS MVP software. So this allows us to compare previous studies from the same patient, whether it's 2 MBS studies, 2 fee studies, or even 1 MBS and 1 fee study, like you can see here. So in this video, you can see that we have a central play button to be able to allow both videos to play at the same time. You can also use the central frame by frame button to be able to scrub through both studies at the same time. And the latest development in this tool includes the ability to compare 2 series within the same study. So for example, if you wanted to view 2 different consistencies or 2 different compensatory strategies within the same study, you can play those side by side as well. So in general, this tool makes it a lot easier and faster to be able to compare the patient's performance on different series, which helps save time for your overall post-study reviewing and analysis. You're also able to take a snapshot within this mode. You can see that camera button right in the middle there. And so this can be used if there's something particularly notable between the 2 studies that you want to include in your report. So for example, if you had a patient that had aspiration on a specific consistency 6 weeks ago, and then when they came in for the repeat study today, they only had penetration, you could scrub through to that particular point in time for both studies, take a snapshot, and then this would then auto-populate into your report. And if you are not utilizing the TIMS report, you can also just simply send this comparison snapshot right to PACS along with the rest of your imagery and can use that for your physician collaboration. Next, we're going to talk about some improvements in the quantitative measurement tools. This first one here is an improvement in the ability to copy and paste measurements. So in this video, you can see that we're using the elapsed time feature to time a component of the swallow. And by clicking on the elapsed time and then using the Control V or paste function on the keyboard, that time is then posted into the note. And I also just wanted to mention here that you might have noticed that the word delta here for the timing function and in the notes, but that just simply means elapsed time. So this quick copy and paste function is another added tool that helps with the overall efficiency of completing your post-study analysis. Next, we have some updates to the freehand tool. So previously, if you're making a line measurement and then stopped and then tried to continue on, the TIMS software would think that you had 2 different line measurements. So now what we're able to do is you can start the line measurement if you needed to take a break or lift off by clicking on the Control Shift. Then you can continue on with your measurement and it will snap to close. And so this was a specific feature that was requested by Dr. James Curtis and several clinicians at NYU. And this next slide is a reference slide that we wanted to put in here for those who wanted some more technical knowledge on file sizes. And if you are working with somebody on your PACS team for advocating to get TIMS, or you already have TIMS but are advocating on sending studies to PACS, this is just a reference for you to see the magnitude of the different file sizes. So this is just something that we wanted everybody to be aware of when you are selecting your software for study recording and archiving. We recommend that you are familiar with the scale of file sizes. This is a visualization demonstrating the different file sizes for recording from the fluoro machine without compression. The middle being the DICOM motion JPEG, which is the compression completed through TIMS. And then on the right-hand side, we have the MP4, if your PACS is able to accept MP4. So this visualization can be helpful for advocating for getting TIMS or just being able to send the imagery to PACS if you already do have TIMS. And speaking of archiving to PACS, TIMS began integrating with AMBU single-use scopes to allow the imagery to be sent to PACS because of the hard work of Laura McWilliams and her colleagues. Archiving FEES studies to PACS was a need for this team, and TIMS helped build a workflow to be able to accomplish this. I did also want to mention that you can archive the FEES studies from any single-use scope, but we just wanted to highlight this specific collaboration. Here you can see we have a variety of setups with TIMS and AMBU. So some facilities will utilize an existing cart, others will utilize a TIMS cart, which is there in the middle at Saddleback. Others will utilize an IV pole setup. So you can have the AMBU tablet mounted on an IV pole, or like on the right-hand side, you can see that the tablet is sitting on the TIMS cart. So there's a lot of different variety of options that can be selected to fit the needs of your team. And then here on this video, on the right-hand side, you can see Jonathan Waller is scoping Brooke with the AMBU scope. So it's a little bit hard to see in this video, but behind Jonathan, we have the TIMS computer. And so for this workflow, the AMBU tablet and TIMS computer are simultaneously recording. That way the study can be edited on the TIMS afterwards and sent to PACS.
Awesome. Thank you, Shannon. So now we're going to discuss continuing education opportunities as well as research endeavors that are supported by TIMS, MVP, and or just supported by our team in general. So first, we wanted to take a moment to highlight the Swallow repository, which was created by Dr. Phyllis Palmer and Aaron Padilla from University of New Mexico. The Swallow repository strives to enhance both student and clinician engagement in swallowing research and minimizes research barriers. This research supports student involvement in research. It aids academic faculty in teaching, provides clinicians with MBS interpretation practice, and facilitates faster IRB approval. Through the work of Dr. Palmer and Aaron, MBS data were retrospectively collected as part of a routine clinical care, primarily following the MBS INP protocol for adults, which we discussed earlier. So this is an open access resource, which is available to everyone, and as we discussed, supports both educational and research endeavors. Here's a screenshot of what the repository looks like. This open access resource offers 91 pediatric and adult MBS recordings. Video acquisition, review, editing, and archiving were all completed utilizing TIMS. So I did want to note that the database welcomes contributions from clinicians to expand the scope, and they are hoping to include additional instrumental evaluations such as FEES and high-resolution manometry. So if you're interested in supporting this endeavor, definitely reach out to Dr. Palmer and Aaron, because I'm sure they'd love to hear from you. So we do have the link to the repository here, but I am going to show a demonstration video of how to access the repository. As I mentioned at the beginning of this presentation, we are very passionate about continuing education and have recently begun partnering with graduate school programs throughout the country. So we're often asked, how can I access abnormal imagery for my students to utilize in the TIMS MVP software? So the repository has been an excellent resource for that. So we want to go ahead and show you all how to access the resource in case you're needing it for maybe team training, maybe you are a professor and wanting to utilize it for your students, or maybe you have some sort of research initiative that you would benefit from using this resource. So like I mentioned, you're going to go to the Aphasia Bank Talk Bank website. I'll go ahead and click play. On this home screen, you are going to click non-protocol English as shown here, and then you'll click dysphagia. And then once you click the hyperlink for dysphagia, you're going to be taken to the main page, which describes what the repository is, as well as where to find more information about participants. On this page, you're able to access the transcripts and the media folder, as well as the downloadable transcripts. Here you can see all 91 studies that are currently in the repository. So if you click on the hyperlink, it's going to automatically pull up the video. And I know you all can't hear the audio, but there is synchronized video and audio with these recordings. So if you were to download this, you'd also have the audio. So if we click back and then we get back to the main page, one of the really cool things about the repository are the browsable transcripts. So as you can see on this page, it walks you through how to interpret some of the aspects of the transcripts, and all of the videos are linked on the left-hand side. So if you click the video open, it's going to pop open there in the bottom left-hand corner. And then again, I know you all can't hear the audio, but they are speaking, and as they're speaking, the transcript is highlighted in yellow as it's walking you through what's going on in the study. So this is, really beneficial if you are wanting to hear what's going on while reading it at the same time, and you can download these transcripts as well as the videos. So next, I'll show you how to download the video for research or educational purposes. When you go back to the main page, and then you click into the media file, as I will do here, you'll see that next to each of the hyperlinks, there's an arrow for the download. So if you click the arrow and then you see my downloads here, you can see that I downloaded one of the videos as an MP4. So I'll go to my next demo video here. So we're often asked from graduate school professors, how do we import these studies into our TIMSS review for our students to use? So like I mentioned, with the repository, you can go in as a professor or a researcher and look at the study and understand, what was going on with the patient, and then set up assignments or learning opportunities from that. So in this example, I've got one of the videos downloaded here is an MP4 on my desktop, and I've got my TIMSS review. So I'm going to go ahead and open up my TIMSS review. And then I'll click New Blank Study, and I will just fill in this information hypothetically, because this is obviously pulling this from the repository. And then I'll click OK. You'll notice that an MBS Looper video pops up. That's just simply because I have that in my TIMSS review at home. But if I go up to the File tab and click File, Import Media Files, I can select what MP4 I want to bring into my TIMSS. So I went ahead and clicked the Swallow Repository video, and you can see it is there on the left-hand side in the Series tab. So now I can go ahead and play this video, and I can review the study frame by frame, just as I normally would. Additionally, excuse me, let me fast forward this again for you all. Additionally, if you wanted to use this for team training or training with your students, you could actually use the TIMSS software like you normally do in clinical practice, creating subclips, label sets. You could use our illustrations to point out various things. You could also use the scorecards that we discussed earlier. So to access those, you just click the score button here, and then they'll all pop up. So you could have your students go through different analysis methods. Maybe one week you're working on MBS INP, or another week you're working on digest. So you could actually have them score these studies using those tools. And then you could also have them fill out notes with the note tab, and then all of that information will populate forward into your customized report, which is here. So we do have professors at the several graduate programs that are utilizing the TIMSS review software in this way for their students. So results and opportunities to learn more. Dr. Palmer et al. In 2023 conducted research to assess the impact of the repository. Their findings revealed that the database was readily utilized by both graduate and undergraduate students to conduct research efficiently. The only consistent barrier identified through qualitative analysis at that time was the pandemic, which limited both access to the campus and reliable internet for streaming. In conclusion, we know that this open source data repository can enhance students' ability to engage in research and deepen their understanding of swallowing physiology. So we just wanted to highlight this incredible resource. and how Dr. Palmer and Aaron were able to utilize their TIMS to help create this tool. And as I mentioned, we are very passionate about continuing education, which is why we are providing complimentary TIMS review donations for graduate schools across the United States. So this is something that we've started recently this year. And it's really because we want to help support the implementation and adoption of best practices and standards at that graduate level. As we all know, it can be really difficult for professors at the graduate level to obtain that abnormal imagery, which is why the repository is such an incredible resource. And additionally, we really want students to have the ability to access some of these analysis methods that we've gone through this evening so far. By using TIMS, they can use the analysis methods that we've discussed. They can use quantitative and kinematic analysis methods in TIMS. They can look at a variety of imaging, both MBS imaging or FEES imaging if you have that, and add in telestrations and notes. And they can also work on creating individualized care plans and reports. So our goal in these donations is really to help give professors the opportunity to provide their students with real-world application of the information that they're learning in their courses. So we definitely want to give a shout out to Dr. Palmer and Aaron and the team at the University of New Mexico for this incredible resource and helping us as we work with these graduate school programs across the United States. Additionally, we wanted to mention that there are multiple speech-language pathologists here on the team at TIMS. So we are all available to help in this process, and we are able to help you with the installation process if you are a professor at a graduate school program that's interested in pursuing this. Additionally, we can help you with the importing abnormal recordings, if you need help with assignment creation, one-on-one training for the software, as well as virtual presentations. We are happy to support with all of those initiatives. So we wanted to talk a little bit about how we hope to help change the future of dysphagia education. As we've discussed this evening, we are partnering with dysphagia programs throughout the United States. And in towards the end of this year, as well as in 2025, we plan to continue to work on updating our website to include additional resources for graduate school programs. So our goal is to include some of those abnormal studies from the repository in collaboration with Dr. Palmer and Aaron. We plan to pull over several of the studies and develop assignments that professors can then go in and download and potentially download the key for the answers. So our hope really is that we can help support education at the graduate level. So if you have any other ideas about things you think would be helpful that we could do to help support graduate students, please let us know. Additionally, we will continue to update our website with other resources that are beneficial for dysphagia education. Like I mentioned earlier in this presentation, if you haven't checked out our resources tab, we do include several different helpful links and sites on that overhead link, which include FEES training and competencies, the gold standard guidelines for MBS and FEES performance and training, as well as other helpful resources. So be sure and check that out if you haven't already. With that, we wanted to wrap up this section by highlighting the importance of clinician, research, and industry partnership. As we demonstrated through this presentation so far, the TIMS MVP software and review station would not be what it is today without the support and collaboration of students, clinicians, and researchers both here in the US and abroad. As I mentioned, and as Shannon highlighted in her discussion this evening, a lot of the tools and features that you see in the software today come from direct request from speech language pathologists like yourselves. And so we really are just so thankful for these partnerships and collaborations. So if you ever have feedback about the TIMS MVP software or ideas of what you'd like to see, we definitely want to hear from you. Additionally, as we've discussed, we are very passionate about continuing education and strive to help provide resources that are backed by evidence that are accessible. So if you have ideas about things, initiatives that you would like us to support, please reach out and let us know. Shannon, did you have anything else that you'd like to add about the importance of collaboration and partnership?
Yes, this is something that I was actually just speaking about with a team of SLPs that I visited recently. The fact that industry partners have a really unique opportunity to help bridge the gap between clinicians and researchers. As Brooke mentioned, TIMS has this opportunity to continue improving our software by collaborating with researchers, adding new tools into the software for clinicians to use. So Brooke and I and the rest of the TIMS team are really grateful for this opportunity to help the field in a unique way. And we're really grateful for everything that you all do for the field as well.
So with that, we want to hear from you, but before we pop over to Slido, I just wanted to take one quick minute to highlight our next session, which will be on the 16th of this month. We know that a lot of speech language pathologists are interested in learning about being a speech language pathologist in the business and industry side of things. So our next session will be hosted with all of the speech language pathologists at TIMS Medical. So the title of the event is Clinical Collaboration and Career Paths, Connect with the SLPs at TIMS. So you can meet each of us and hear about why we are involved in business and industry, as well as our individual roles here at TIMS. So with that, we would like to hear from you. So we've got a Slido. So if you want to scan the QR code, and I'm going to hop over to the Slido. 1 second here. Okay, awesome. So we'll give everyone a minute to log on and vote. We wanted to hear from you all. What analysis methods are you using in your clinical practice for MBS? Looks like a lot of MBS IMP. We'll give people just another minute to vote. I actually can't see how many people are voting. And if you're using other, we'd love to hear from you in the chat what other tools you're using. Oh, yes, and I will post the link for the survey here in the chat before we log off. Okay, awesome. So we've got a lot of MBS IMP users and a combination of the above. Yes, awesome. Yeah, I know in my clinical practice, I use MBS IMP Digest, and I did the REST training. So I'm excited to implement that as well. And we do have a lot of other tools in the TIMS software as well that are beneficial that we did not highlight tonight. So if you have TIMS, be sure and check those out as well. Awesome. So if you are using MBS IMP, consider adding your scores to the registry to add to that database of information for research purposes. Okay, with that, we're going to go to the next one. What analysis methods or scorecards would you like to see in future software releases? So we didn't go through all of them. I'll try to list them all off by memory. Right now, like we mentioned, we have the MBS IMP, the digest fees. The rest will be added soon. We have the Yale, the Voice, the EAT-10. Trying to think what else we have. We have the Murray, or no, we have the New Zealand secretion rating scale. We do have the PAS. Do we have anything else that I didn't mention, Shannon? Lots of PAS.
Yeah, we have a few new ones coming. The reflux symptom index, reflux finding score are coming in a future release as well.
Awesome. Yeah, so we do have the penetration aspiration scale in the software. So be sure and check that out. And I see one about reflux. Awesome. Does anybody else have anything else they'd like to see in future releases? I know we've had some requests for aspect and VASES. So we are in conversations with the incredible researchers behind those analysis methods as well. Oh, yes. Okay, awesome. I'm glad somebody highlighted the baby VFSS IMP. That will be in the TIMS software. If you're requesting that, you probably know it's not available to the public yet. I'm not exactly for sure on the timeline, but once that is available to the public, our team will be working with Dr. Bonnie Martin-Harris to input that into TIMS. So stay tuned for that. As soon as we know more, we will definitely let you all know more, or we will definitely let you all know as well. Okay. Your opinion, what are some ways you might use patient view in your practice? So that was the tool that Shannon highlighted where you can do simultaneous MBS and fees studies, which is what Dr. Langmore was using it for previously. And you can also record internally and externally simultaneously, as I did in the manual therapy video. So we'd love to hear from you. If you had access to patient view, how might you use it for your clinical practice? Or maybe you have a research initiative you'd like to use it for. As Shannon mentioned, it's beneficial for manual therapy. So I would love to, use it for educational purposes, demonstrating the benefits of various manual techniques. I think if you are doing manual techniques in your practice, you might be able to attest that sometimes you're demonstrating it to the patient. Maybe they ask you, well, how does this impact the internal anatomy? So patient view is a really nice way to demonstrate that in real time. Yep, treatment practice and feedback would be great. Feedback of strategies, biofeedback, yes. Agree to all of those. I'd love to do a simultaneous MBS and FISA myself. Okay, and then what tools would you like to see in upcoming TIMS MVP releases? So this is a little bit different than the analysis methods. Think like the freehand tool with the snap to close, the magic wand, the magic brush, the compare feature. Are there any things that you all can think of that you'd like to see in upcoming TIMS releases, or maybe updates to tools that are already in the software that you would like to see in future releases? And I will say our engineering team is wonderful. They watch a lot of these webinars and do take the feedback and make updates. So if you have ideas, please let us know because we'd love to hear from you. Looks like some people are typing. Compare feature would be great. Magic wand too. Yeah, so we do have the compare feature already in TIMS, like Shannon highlighted, so that can be used within the same study or between two studies for the same patient. And then the magic wand and the magic brush, we did not go over this evening, but we talked about them at our last session. And those can be beneficial for measuring bolus percentages. So typically we recommend that you use the smallest line outline, and both work in a little bit of a different way, but they allow you to analyze bolus percentages. So if you haven't checked those out, you can see them in our last TIMS users group meeting, which will be available on YouTube tomorrow, or we do have tutorial videos on our website. I will say that, you know, if you have a little bit of if you have image quality that's not quite as clear as some of the image quality that we demo with on TIMS, which I can attest to in clinical practice, sometimes the fluoro imagery is quite that clear. I personally find the freehand tool to be the most beneficial for measuring bolus percentages, which is where that new snap to close feature that Shannon mentioned that was requested by Dr. James Curtis and other users. That can be a really helpful tool when you're trying to increase your accuracy and measurement. Okay, someone said being able to change over labels easier from label drop downs. Shannon, do you have an idea of what that means?
I was questioning if it was about maybe once you've labeled it and then you want to change the label. I'm not sure if that's quite what they meant, but I don't know if you guys can type in again, or if whoever posts that wants to type in the chat to add a little bit more detail to let us know what you meant. But you can change the labels if that was what you meant by that. So even if you during the study select a label, but then later in your review want to change it because maybe you just clicked on the wrong consistency, or you want to add a note, like you want to add that there was aspiration or something, you can do that as well. So that's again, it's been some on our, you know, later TIMS MVP updates have come out with more ease of labels. But if you meant something else, please definitely let us know, type in the chat. We can explain a little bit more.
And we mentioned at the beginning of this presentation, you know, that we're trying to help improve the implementation of standards and protocols in practice. So TIMS does come with label sets. So for example, TIMS comes with the MBS IMP label sets. So you can use those, but you could also use your own. So maybe your team has a certain protocol that you're using in your FEES performance or your MBS performance. You can actually create your own label set as well, like Shannon mentioned. And we do have tutorials of how to do all of this on our website, but if you're ever like you're in the Flora suite or you're in your office looking at TIMS review, you can also access information on how to do all of these things under the help tab in your TIMS, and then click on the training guide.
And something else I'll just add real quick, Brooke, too, is that if they perhaps were saying maybe a different way to label instead of the drop down, there is the ability to do protocol mode. So if you were just following the MBS IMP or some kind of specific protocol, you can click on that clipboard, and then you can use the keyboard arrows to move to the next consistency. So that's a little bit faster than the drop down. So perhaps maybe that was the question as well.
Awesome. So our last question is, what topics would you like to see discussed at future TIMS user group meetings? So like I mentioned, I said this month, but it's next month as of tomorrow, or this month, I guess, as of tomorrow, October. We will have a session with all of the speech pathologists from the team. And we do have plans to host our CEO so that you all can ask him questions. And we have some researchers coming on to discuss kinematic analysis and how they're using TIMS for research. But we'd love to hear from you. What all would you like to see discussed at future meetings? And like I mentioned, we are planning on hosting some in-person events coming in 2025. But if you are at the ASHA convention this year, be sure and stop by our booth and hang out with us. We would love to see you in person. We'll be doing some live scoping and of course have Tim set up. So if you want to play around with the analysis tools, you are more than welcome to do so. Okay, with that, I'm not seeing any topics, but if you have an idea for a topic that you would like to see and you think of it later on, feel free to email us at tims-univ@tims.com. I'm going to stop sharing for a minute just so I can grab the survey link for you all. I'm going to pop it in the chat. Like I mentioned at the beginning of this webinar, the link will be sent out again via email from Zoom. However, I know sometimes people aren't signed up for emails from Zoom. So if you don't get it, it's okay. It'll be on our website as well. Let me grab it for you real quick. There it is. Okay. Sorry, everyone. I didn't have the link already copied. Jen, did you have anything else that you wanted to say before we close out for this evening?
Yeah, I'll just kind of reiterate that if there is any feedback that you guys think of, please let us know. You know, you can reach out to any one of us. Like Brooke said, the engineering team is really awesome and always excited to hear feedback. So if you do think of anything, please let us know.
Oh, okay. I see. We do actually have a couple of comments and questions. So I just popped the link in the chat. Okay. And Adrian said, Dr. Palmer's resources are fabulous and I've used them since she first shared them with me. I love that you all are working on opportunities to help us as professors get better training. Awesome. Well, thank you for all that you do for our students and the future of the field. It's definitely much appreciated. Oh, okay. Hold on. I posted it and it said it's only going to the hosts and panelists. Hold on one second. Sorry, everybody. Okay. Okay, there we go. Okay. And someone commented and said, patient view is not de-identified. What about HIPAA? So, I mean, well, patient view, if you're doing the patient view recording, you would be doing that like in place of your normal fees or your normal MBS. So my thought would be that you would be archiving that over to your PACS or VNA. So you wouldn't necessarily be, unless you're using it for research purposes. And then at that point, you would need to get consent from the patient to utilize the video, if that makes sense. But if you're using it in clinical practice, you would just be using that feature just like you would your normal TIMS with fees or TIMS with MBS, and then archiving that information over to your PACS or VNA. And with that, we only have a couple of minutes left before 9 o'clock. Does anyone have any other questions or comments? Yeah, so Kristen asked, are we going to get a version of the slides or anything? I can definitely include the link to the slides in the emails from Zoom. Like I said, if you all aren't signed up to get the emails from Zoom and you realize that you didn't get it, just send me an email at, here, I'll put it in there, tims-univ@tims.com, and I can send you a link to these slides. And then the replay of this presentation will be up on YouTube later this week. So with that, we just want to thank you all for being here with us this evening and spending your time with us. And we hope to see you at our next event. Have a great night, everybody.
Thanks, everyone.